A very good morning to you and welcome to Your Health this Wednesday morning. And today we are discussing antimicrobial resistance. And with me is a panel of gentlemen who are well versed with this topic. And we'll be taking you through what antimicrobial resistance is, what antibiotic resistance is, the causes, and what you need to know so that we don't, as individuals, not contribute to this issue of antimicrobial resistance. So to start us off, I'll just do a brief introduction of what antimicrobial resistance is. And antimicrobial resistance basically means when microorganisms change ways that render medications that they used to treat some of the infections they cause ineffective. And by microorganisms here, I mean parasites, bacteria, viruses, and the like. This that cause several infections that we are all aware of, be it flu, sore throats, stomach infections. These are what we are talking about. Now, the issue with antimicrobial resistance and use of antibiotics and other medications on this is that they can kill, they can spread to other people, and at the end of the day, they're very costly to treat. And case in point that most of you may be aware of is like multi-drug resistant TB that takes years to treat. Now, what causes antimicrobial resistance? Normally, it's natural, where microorganisms, bacteria, parasites, and viruses just become resistant to the medications that are used to treat it. But it's also facilitated by the inappropriate use of antibiotics or medications by people, low-quality medications, wrong prescriptions, like using antibiotics, for example, for flu that is caused by viruses, poor infection control, poor surveillance of diseases, and poor surveillance of what causes diseases. Now, why is this issue of antimicrobial resistance important? There are certain instances where antibiotics and some medications are quite important, like in organ transplant, chemotherapy for surgery, for cancer, and in major surgeries. Now, when microorganisms are resistant to antibiotics and other medications, then these life-saving treatments become risky. Now, with me on the panel to discuss this topic is Dr. Collins Jaguga. Dr. Jaguga is a program officer. He's a pharmacist and a program officer at the Ecumenical Pharmaceutical Network. Also with me is Dr. Jared Nyakiba, who is a pharmacist also, and from the Ministry of Health and a public health specialist. Also, Dr. Alan Azegele, who is from the Division of Veterinary Services. Now, we'll take you through just a brief story that we had filed earlier on this issue of antimicrobial resistance. And here we are bringing in the link between use of antibiotics and the risk to humans. Now, many of us, if not all of us, have used drugs for the treatment of infection at one point or another. Farmers too use antibiotics on their animals, but some use them to promote growth in their animals. This use and sometimes misuse of antimicrobials is putting all of us at risk of resistance to these drugs, making it more difficult to treat simple infections. And the link between the use of antimicrobials in animals and resistance in humans is here and real. Let's take a look at that story. Most of us do enjoy a sumptuous meal of chicken anytime. What we may not realize is that what the chicken is fed on may cost us our health. These include antibiotics used on the poultry. Bernard Kabu is a poultry farmer in Githurai whose preference is on indigenous chicken because of the minimal use of medicine.
Most of them are free from medicines. Those that can harm your body, they can add some, what they say. Medicine are not good for your body. You yourself as a farmer, you're not a doctor. You can diagnose a certain disease, but you are wrong. The signs that you read, they are wrong. So you go to the veterinary, you buy a certain medicine, but once you come to administering to them, it is not the right medicine.
Experts agree.
Any person is keeping chicken or is keeping animals, you find that there is no thought about the antibiotic they are going to use. Eventually, you find that those are the foods that are being used by human beings, and therefore the resistance that is created at the animal level is transmitted to humans.
The matter of antimicrobial resistance is of major global concern, forming a major highlight at the 71st session of the United Nations General Assembly. The Food and Agriculture Organization Director General, Jose Graziano, noted the need to use antibiotics and other antimicrobials prudently.
Antimicrobial medicines used for growth promotion should be phased out immediately.
This is still being practiced in the growth of poultry.
They tend to boost them. You know, they take on 4 weeks to 6 weeks and they are mature. A kienyeji chicken goes for 6 months until it is mature.
Our main concern actually starts from animal use, because there are certain antibiotics that need to be reserved for human use.
Experts globally are concerned that we may be getting into a post-antibiotic era where even the most minor of ailments could be fatal. By 2050, more than 10 million people may die annually due to antimicrobial resistance, a number higher than those who may die of cancer.
It is very, very possible that without any antibiotic that is effective, we are going back to where we were during the times when we used to suffer through epidemics that could wipe out whole populations.
The good news, however, is that in March 2017, a major global partnership called Combating Antibiotic-Resistant Bacteria Biopharmaceutical Accelerator announced a $48 million investment into 11 companies into projects against these superbugs. The last time antibiotics were developed was in the 80s. This investment may breathe a new life into the fight against antimicrobial resistance. Dr. Masi Korir, KTN News, Nairobi. Okay, with me today to discuss this issue of the use of antibiotics and antimicrobial resistance are 3 gentlemen who are well versed with this topic. And to my extreme right is Dr. Alan Azegele, who is the Deputy Director from the Directorate of Veterinary Services, and Dr. Jared Nyakiba, who is a pharmacist and a public health specialist, Dr. Collins Jaguga, who is also a pharmacist, and a program officer from the Ecumenical Pharmaceutical Network. Now, I'll start with you, Dr. Azegele, to just explain to us what is really the link between use of antibiotics in animal or in farming and finally to resistance of antimicrobials in humans, because it may not be so clear as to using antibiotics in chicken, for example, as we've seen, and finally me developing a resistance to some of these bacteria.
Thank you, Masi. Generally, first, as I begin, I would want to say thank you to KTN for allowing us this opportunity to come and share more about antibiotics use, and then also with regard to the resistance that develops. As you know, when you use antibiotics in farming systems, there's the possibility of the development of the resistance in the process due to either, as you said, using it on wrong prescriptions, using it without seeking advice and all that. Now, as indicated in the poultry production, as the clip had just shown, you will find continuous use challenges the microorganisms in the poultry to low doses of exposure to the molecules, the antibiotic molecule. These bacteria tend to develop resistance in the process, and at the same time, you find infections that are caused in the birds by those bacteria are the same bacteria that cause infection in man. The contact between human and those birds, and at the same time, you find you end up slaughtering these birds, get access. You open up the viscera, the stomachs, and you find these bacteria that are resident in the intestines of these birds have already developed resistance. In the process, should you get infection by these organisms through contact, you end up finding it difficult to treat, because probably the condition you'll be suffering will require treatment by the same drug that was exposed to these birds. Now, at the end of the day, the doctor will continuously apply the correct medicine in his opinion, but apparently it's not working. And the reason being, what you had done to your birds is what now is reflecting in you. And that is mainly through the contact you may have with this and the exposure you have to these microorganisms. Yeah.
Okay. Dr. Nyakiba, from a pharmacy point of view,
Yes.
we'll use the same medication for humans, but then they'll not work. What's next after then? They're not working yet. It's really difficult to pinpoint that it's from the chicken you handle or the cow that you handle that you got this resistance. But then at that point, as a patient, when I'm taking that medication and it's not working, I will not know. So what is there next for such a person?
Well, thank you. That complicates matters for healthcare. Antibiotics, in terms of use, we have what we'd call, for example, a first line. This is what you would normally use when patients visit the doctor. This is what the doctor will prescribe for you. Now, if that particular antibiotic does not work, it means we have to keep using further and further, usually more toxic drugs, so that's a problem. Number two, it means we'd also use more expensive drugs, which again presents a problem from a health system perspective. You're moving from low-cost to fairly high-cost drugs. Again, antimicrobial resistance is like, it presents a doomsday kind of scenario. A post-antibiotic era is quite scary. We are talking of millions and millions of people at risk of death. As it has been said that if we continue with the same path, we'd be by 2050 talking of 10 million people dying, 4.5 million of which would be in sub-Saharan Africa. So from a patient perspective, that means you are at higher risk of death, you're at a higher risk of complications from that infection that would normally be a treatable infection. And it also means you have to spend more, or the insurance company has to spend more and get less in terms of what you want to achieve. So it's something that has consequences from the individual level to the population level and to society, etc., and to the government also.
So what are we doing about it, Dr. Jaguga?
Well, we do have systems in place, both as a country and even as EPN. We do have programs to promote antimicrobial stewardship in healthcare facilities. We do support healthcare facilities have infection prevention and control programs. We help healthcare facilities have antimicrobial stewardship programs so that antibiotics are prescribed rationally, they're dispensed rationally, and there is proper patient counseling on the use of antibiotics.
Now, you've talked about the antibiotics are dispensed and used rationally. But then as healthcare providers, there are times when, for example, a mother comes and they say, you know, my baby has a flu, and it's only such a medication that works for this patient. And most of the time, there are certain line of antibiotics they list. And so as a healthcare provider, they are caught in between a rock and a hard place. But what happens is they eventually end up prescribing that antibiotic for a flu, for example, that is caused by a virus. So who is to blame in this case? I don't know who wants to take up that.
My call would be to the healthcare professionals. It is incumbent upon us to seize that opportunity to educate that mother, to educate that patient, that for the common cold, which is a viral infection, there is no benefit in using an antibiotic. So healthcare providers should not succumb, should not give in to the pressure that mothers or patients give. But they should take that opportunity to educate the public, to educate the patients on rational use of antibiotics and the ill effects if these antibiotics are used when they are not warranted.
But this happens almost on a daily basis, Dr. Nyakiba.
Yes, it does. We usually like saying that Kenyans come to the doctor and tell you niko na malaria and I want a specific, ama niko na homa and there's a specific antibiotic that they maybe saw the neighbor or the brother and sister using, and they want that specific one. So I think the issue is also, as Collins has said, one, the professional needs to be professional. That's one. But two, also we need to, and this is part of it, as what we are doing today morning, is to educate and create awareness to the public that using an antibiotic when you don't need it is actually harmful. You're exposing your body to toxic likelihood of toxicity vis-a-vis not getting benefit. So, and you're using your money for something that will not give you any particular benefit. So there is the public awareness and patient awareness component of it. Yes, this happens frequently also, maybe largely because of the profit motive. Remember, if I sell you an antibiotic as a pharmacist, I make money. So there is that element also. So I think antimicrobial resistance as a threat where we are now, we have to look at the system afresh, relook at the incentives. How do we create an incentive? For example, now that you mentioned, for a pharmacist in a pharmacy, not to dispense the medicine as opposed to the current incentive, which is to sell you anything you want. So there is that we have to relook at the system and look at what are the incentives and disincentives towards proper practice and disincentivizing inappropriate use. Yeah.
But then we use this same medication on animals, as we've seen it. Do farmers know that whatever they use on the animals will eventually land on our tables?
I would say, I would say no. It depends on the knowledge level of each farmer, because as just to pick on what you are saying about viral infections, you find there are some farmers who are knowledgeable that there are some viral infections which are not treated by antibiotics. But as you know, when an animal is suffering, say, foot and mouth, its production is diminished, appetite goes down, and there could be opportunistic infections that set in. So that's the time to engage the professional, to assess and see where to intervene. And it's only to intervene for the opportunistic infection that would bring that animal down, not because of the viral infection, but because of the bacterial infection that has set in, to take advantage of the weakened resistance in terms of immune system. Now, sorry, you was guiding me on some...
do the farmers know that whatever they do will actually eventually end up affecting us on our tables?
On the table?
Yes.
Well, it's profit-driven in some cases. A farmer may have treated his animals and realizes that they are due for sale to the market. You may find you are a broiler chicken, you're producing chicken, broilers, which mature in almost 6 weeks, and you find at some point there could have been a disease that struck. You administer drugs, and instead of waiting for the period within which the drugs can wear out, you end up seeing there'll be greater losses, because if you keep them longer, there'll be more feeding and you'll spend more. And at the same time, they may even overgrow the weight that you're targeting, and you release them to the market. That is something that is very critical in avoiding residues of drugs in the meat. But it's a bit different with regard to residues vis-a-vis when you focus on antimicrobial resistance, because the drug residues elicit different reactions. You may find allergies being manifested when you consume. So you may find somebody telling you, whenever I take goat meat, I react. But it may not be anything in the meat itself. It could be a drug which had been used, which you're sensitive to, and it elicits a reaction in you. And probably that's a one-off reaction, and yet when you eat other kinds of goat meat, you find you're okay. So this is what comes out, and we would want to encourage farmers to appreciate that any time you use drugs, do not just prescribe yourself or assume the way it said, I have a homa, this is this. So this animal requires a drug for the climate. You know, that's something that is talked about. You're buying an animal and you say, since I'm moving to my place, nataka idungwe shindano ya climate. So you know, those are the things which tend to come up. And you have to actually seek professional advice whenever you're to use any antibiotics.
But even on animals and humans, how many people, you know, people take, this is just a simple flu, they go over the counter and buy self-prescribed medication to take. So how often do farmers or the people who keep animals look for professional help?
Generally, I would say not a huge percentage, because it also depends on if the professional is accessible and available. That service, if it's available in your area, you will definitely go for it. But for a greater part within the country, you may find there could be challenges in finding an animal health professional. But where there is the service is available to the farmer, it's all a good number do seek the professional advice. And also the various networks within the government, like the way the government is structured. Government always has veterinary professionals well spread within the country. But there could be currently a shortage in some areas within the country where you'll find the veterinary professionals may not be available or accessible to provide the service.
Okay. And then from a human health point of view, many people self-prescribe, as I'd said earlier. They go over the counter, and sometimes even the people that are over the counter may not be the right professionals to advise. And this has largely contributed to the problem that we are having of antimicrobial resistance or resistance to some of the medication. So what is happening in terms of sensitizing the public to seek the right professional help? And I know you'd say, you know, seek the advice of a doctor, but how many people afford to pay that consultation fee to seek the professional help from a doctor? So what other options are there for people whose option would have been just to go over the counter and order that drug that they think it is right for them?
So that's an interesting question. The option as it is right now is there is no shortcut to seeking professional advice. There is a reason society has created the professionals for each and every sector and area of operation. And these are resources that are available to us as a society so that we can improve our quality of life through improving our health. So as of now, I hesitate to suggest that there is an alternative to seeking professional advice. That is the only route. If you feel that you are unwell to the extent that you need to get medication or to get treated. So seeking professional advice is a way to go. Those who cannot, remember, even for those who cannot afford to see a doctor or others, cadres of health professionals, first of all, government services are available. They charge way less than private, for example. And also cost sharing, for example, is highly minimal now. In fact, it's free in primary health facilities. So, and it's easy to, and it's not, well, it's not easy, but it's, you know, it's possible to get a waiver for those who are extremely deserving. So the best is to seek a health professional. A professional doesn't have to be the person you pay 5,000 shillings consultation fee. A professional can also be your nearest health center, totally free, walk in, have a talk, 15 minutes, and you're done. I know we don't tend to use health centers. We assume they are, first of all, for the rurals, and no. Even Nairobi has a health center, right? Many of them. So walk into a health center and seek a professional opinion.
Okay. Your comment on that?
Yeah, and just to add on to what my colleague Jared has said, it may appear expensive in the short term, yeah, by going to seek professional advice, by seeing a medical doctor. But if you think about it, if there is continued irrational use of antibiotics as a result of self-medication or going to the pharmacies and antibiotics are being dispensed over the counter, and we're talking about antimicrobial resistance, if you got to that point and you had an infection that could not be treated by the antibiotics that are available, and then you had to go to the second line, third line, or worse still, you are in intensive care, then the cost will be much, much higher. So it may appear in the short term that it is expensive by seeking professional advice. But in the long term, as a result of antimicrobial resistance, the costs would be much, much higher, both for you as an individual, the community, and the healthcare system. Yeah.
Okay. I think we've said antimicrobial resistance a lot. It may sound like this big animal. I don't know if any one of you gentlemen want to really simplify it, because, well, people may think it's resistant to certain medication, but in effect, it's the bugs that are in the body that have developed a resistance to some of these antibiotics or antiviral medications that we use. And case in point that I want to highlight is on multi-drug resistant TB, where when it's multi-drug resistant, it's resistant to 2 of the antibiotics. When it's extreme drug resistance, TB is resistant to 4 of the antibiotics. And this takes years to treat, as opposed to the TB that will take 6 months to treat. Now, in terms of the cost to healthcare, both in the long term financially and also just when somebody's sick and they're out of service, what cost implication is there to healthcare to have this resistance to some of these antimicrobials, some of the medications that we are using? Okay, let me start with you, Jared.
Okay. Yes, when you say antimicrobial resistance, it sounds quite a mouthful. Maybe for the general public, a more understood term is antibiotic resistance. Antibiotics are part of antimicrobials. So in essence, I hope I can do well in breaking it down, is you are taking an antibiotic because you have an infection caused by some bugs, as you put it. And now in this case, the antibiotic is not working because the bug is not is resistant to that. It's not the human body that is resistant to the drug. It's the bugs that are causing an infection being resistant to the drugs that you're taking, which means they are not working, in essence. When you're sensitive, it means they are working. So let's say you have pneumonia or you have TB, the example you've given, and you are properly diagnosed, professionally properly examined and diagnosed. When you're put on treatment, it works. So we say that should be the normal scenario. In this other case, we are saying the resistance is present because the drugs that you are taking are not working. Mm-hmm. Now, in terms of the cost that you asked, so take up, and I think you picked a good example. In an example of TB, which is a disease of national importance. Yeah. So as government, you're spending money. For example, the government of Kenya is spending money to treat TB patients, a certain amount of money X per patient. So every Kenyan who walks in diagnosed with TB is treated with a certain amount of money. Now, when the same or a different patient walks in with multi-drug resistant TB, then we are now talking of several times higher than what you would spend had it been not resistant. So and that's just on one patient level. Now multiply it by the thousands and thousands of patients we have. For example, for HIV, for malaria, you're doing millions of treatments a year. A small change is significant in terms of finances. So as a nation, as a society, as a people, you're losing money because you're moving from a low-cost intervention to a higher-cost intervention. Mm-hmm. And again, as you said, majority of the causes are preventable. So there's a significant cost to antimicrobial resistance. Now, this acquires an interesting perspective. Now, think about it in terms of poor countries, or, well, poor in quotes, countries, you limited resources, extremely limited resources. You do not want to spend more money on what you would have spent less money and gotten the same outcome on. So there's a significant, for example, for the common man, it also means we have to increase budgetary allocations to accommodate antimicrobial resistant infections. And that acquires, which means some other function of society will have to get a budget cut. So they are significant cost. To the Kenyan, it means, for example, if you're paying, instead of being admitted for 4 days, you might end up spending 15 days, in hospital. So you also pay more simply because of this, yeah.
Okay. I'll keep it there, then I'll get your cost of, the cost of this resistance to healthcare. We'll take a short break, but just hold your comments on that. That's where we'll pick it from, as we also look at what other countries, because you may think this is just a local issue, but you'll actually, I'll give you a list of what other countries are actually have reported in terms of antimicrobial resistance. So we'll take a short break from there, and when we come back, we'll continue with the conversation on antimicrobial resistance and what has brought us here and what is being done about it and what we can do as individuals so that we reduce the effects of antimicrobial resistance. We'll take a short break.